Today, we need to talk about something really serious and, frankly, pretty scary. It's the surge of kids and teenagers showing up in our emergency rooms in the middle of a severe mental health crisis. It's something that's been happening behind the scenes, but the numbers, well, the numbers are telling a story we can't ignore.
So let's just start with one single jaw-dropping number, 14. That's it. Since the pandemic, the number of psychiatric consultations for kids in the ER has gone up 14 times. This isn't just a small increase, it's a tidal wave that hospitals are trying to deal with every single day.
And look, this chart really puts it into perspective. This data comes from a study across multiple centers, and you can just see it. The little bar on the left, that was the world before. The huge bar on the right, that's where we are now. A jump this big isn't a trend, it's a system that is absolutely screaming under the pressure.
So what is going on here? Here's what we're going to do. First, we'll step inside the ER and see what that process actually looks like for a kid in crisis. Then, we're going to unpack the three biggest reasons they're ending up there: eating disorders, crippling anxiety, and suicidal thoughts. And finally, we'll zoom out and look at the bigger picture, the things in our society that might be fueling this crisis.
All right, let's start by walking through those ER doors. What actually happens when a young person arrives completely overwhelmed by psychiatric distress? It's not chaos. It's a very careful, very structured process that's all about two things: evaluation and safety. So the whole journey kicks off the second they arrive with triage, where staff figure out how urgent the situation is. Right after that comes a really detailed diagnostic evaluation. Based on that, they create an intervention plan, which all leads to this massive decision. Can this child go home safely, or do they need to be hospitalized right now? And during that evaluation, the team is looking at so much more than just what the patient is saying. They're observing everything: their appearance, their attitude, how they're thinking, how well they can control their impulses. They're also looking for any signs of aggression and asking about really basic things like sleep and appetite. You know, when those biological rhythms are off, it's a huge clue that the mind's distress is showing up in the body. And safety is it's everything. The room itself is designed to protect the patient. The bed is literally anchored to the floor. The doors open outwards so staff can't be blocked in. The entire room is stripped of anything that could possibly be used for self-harm, and there are emergency alarms everywhere. Okay, let's get into the first of the three major conditions we're seeing: eating disorders. These are incredibly complex illnesses, and they have really serious physical consequences. The ER often becomes the last line of defense when a child's health is in immediate danger. The warning signs can be behavioral, like sudden drastic changes in diet or exercising obsessively. But they're also deeply physical. Things like damage to dental enamel from purging, hair loss, or for girls, losing their period. These aren't just symptoms, they're alarms, signaling that the body itself is in crisis mode. And this is such a crucial point. An ER visit is almost never the start of the struggle with an eating disorder. The medical team's job in that moment is to figure out the immediate danger. Is the child's heart rate dangerously low? Are their electrolytes all out of whack? The key decision is whether they need to be admitted for safe medical stabilization and what's called renutrition, which is the incredibly delicate process of reintroducing food to a body that's been starving. All right, the next major condition is severe anxiety and panic attacks. Now, a lot of us feel anxious sometimes, but a true panic attack is a whole different beast. It can be so physically intense that it feels just like a medical emergency, which is exactly why so many kids end up in the ER. I mean, try to imagine it. A sudden, crushing wave of terror that hits you out of nowhere, often for no reason at all. That's a panic attack. The symptoms are so physical. Your chest hurts, you can't breathe, your heart is pounding out of your chest. It feels so real that people genuinely believe they're having a heart attack or that they're literally about to die. And that leads to the most important question any ER doctor has to ask when a patient shows up with these symptoms. How do we know for sure it's just a panic attack and not something else that's life-threatening? So this is where the real medical detective work kicks in. The doctors have to rule out a whole list of other things that can look exactly like a panic attack. They'll check the heart for arrhythmias, test for an overactive thyroid, check oxygen levels. They'll even look for substance use or certain types of seizures before they can finally, confidently say, okay, this is a psychiatric issue. Now we have to turn to the most difficult and most serious reason for these ER visits: suicidal thoughts and behaviors. This is a topic that needs a lot of care, but it also needs a lot of clarity, Because if we want to prevent it, we have to understand it first. When professionals are trying to figure out the level of risk, they make this really key distinction. On the left, you have active thoughts. That's what a person sees themselves as the direct cause of their own death. They're thinking about a plan. On the right, you have passive thoughts. This is more like a wish for death to just happen. Like, I wish I just wouldn't wake up tomorrow. Understanding the difference is absolutely critical. And please listen to this, because it might be the single most important message in this whole explainer. There is a dangerous myth out there that asking someone if they're thinking about suicide will somehow plant the idea in their head. It's not true. All the research, all the clinical experience, it's crystal clear it does not. For the person who's suffering, being asked that question directly, it's often a profound relief. It finally opens the door to talk about it. So based on that conversation, the clinicians figure out what to do next by sorting the risk into 3 levels. If the risk is low, there's no clear plan, they might be discharged home with close family monitoring. If the risk is high, meaning they have a specific plan or they've recently attempted, hospitalization is absolutely necessary. That middle intermediate level is often the trickiest, and the decision to admit or discharge often comes down to how strong and supportive that family environment is. Okay, so we've been inside the hospital, we've seen the process. But the last piece of this story is trying to understand why. Why is this happening? Why are so many more of our kids hitting this breaking point? Well, the experts point to a few different societal pressures all hitting at once. 3 big factors really stand out. First, we're seeing more vulnerable, less structured family environments, which means more kids are feeling like they're on their own. Second, the isolation from the pandemic did real damage to social skills. A lot of kids just didn't get the practice they needed. And third, there's a rise in bullying, which some researchers think is a reflection of a more aggressive society in general, and that's trickling down into our schools. And all of this leaves us with a really big, vital question. The ER is the last resort. It's a safety net, not a solution. The crisis we're seeing starts long before a kid ever gets to the hospital doors. So the real challenge is for all of us. In a world that feels more and more isolated, how do we rebuild that village, that network of support that it takes to raise a child? Thank you for joining me.